I think in many ways my colleagues and myself, we summarize the main issues, and I'm not going to repeat them, except to say that we are going to create a consensus statement which will represent the key directions we think that should occur, or the key areas that should be addressed in the next few years by Canada as a nation. And we do so much in many areas of medicine, and we have a lot of statistics to be proud of. There's no reason to neglect the pregnant woman. Canada is leading many other countries in how they support new mothers to stay at home with their kids socially more than many other countries. There's no reason to neglect that group in pregnancy. It just doesn't make any sense, not on a moral, ethical, and clearly not on a medical level. We have some of the best universities and systems in the country, coast to coast, and there's no reason not to use that information for betterment of Canadian women and children, which is our families, which is everyone. It's not a small group. And Dan Ferrin related to it in his talk. Women now postpone the start of the family, often into the 30s and more. At that time, many more women have medical conditions that need therapy. So we will see more use of drugs, not less use of drugs. And then there's all the twin and multiple pregnancies, all the new attempts to help a family to have pregnancy. So we are not going to see less severe pregnancies. We are going to see actually more burden. Last but not least, now kids survive. So ethically and genetically, there's a second generation of kids that, say, a generation ago would not survive. All that means one thing. The issue is not going away. If we are not developing a national strategy how to deal with this, it will not go away because we'll have more women at need. There are more high-risk pregnancies, as every obstetrician, neonatologist can tell you. In concluding, I want to thank all of you for coming. I wish to thank our sponsors, Duchenne, who arm length, without any control on what went on today, for their participation, and in particular to Anne, to Caro Boyer, who is not here, but really helped put together, and Eric Gervais for his vision to allow us to take this as part of the Therapeutic Congress. And I wish all of you to enjoy the rest of the meeting. Have a nice day.